welcome. If you're getting ready for your NHA or CPT phlebotomy exam, you are in exactly the right place. We're going to walk through everything you need to know to master capillary puncture and feel confident on test day.
So, here's how we're going to break it all down. We'll start with the why, when you'd even do this procedure. Then we'll get into the tools you'll use, the step-by-step process, a few special cases, and we'll wrap up with the really crucial stuff, safety and how to avoid common mistakes. Okay, so let's jump right in at the beginning. Before you can master the how, you've really got to understand the why. So when is a capillary puncture the right call, and why would you choose it over a regular venipuncture? So what is capillary puncture really all about? Well, at its heart, it's about being incredibly precise while having the smallest possible impact on the patient. It's the go-to method for newborns to avoid taking too much blood. It's also perfect for adults who might have fragile veins or for those quick point-of-care tests where you just need a drop or two. Now this, right here, is something you absolutely have to know for your exam. Capillary blood and venous blood are not the same. Capillary blood is a mix of arterial blood, venous blood, and tissue fluid, so its glucose level is actually higher. On the flip side, venous blood has higher concentrations of things like total protein and calcium. That's why you always have to document where the sample came from. This table is a fantastic way to see this in action. For a newborn, you're doing a heel stick, period. You want to prevent something called iatrogenic anemia, which is just a term for anemia caused by drawing too much blood. For an adult with tricky veins who just needs a glucose check, a finger stick is perfect. But for something like a coagulation study, you need the volume from a venous draw. No way around it. You know, knowing when not to do a capillary puncture is just as important as knowing when you should. All of the tests you see here need a larger amount of blood than a finger stick can provide, or they have really specific additive ratios. If you try to do a microcollection for one of these, you're just going to get a rejected sample. Okay, so we've got the why down pat. Now let's move on to the what, the specific tools you'll need to get a perfect sample every single time. The lancets we use today are pretty amazing pieces of safety engineering. They're designed to be used only once, they come sterile, they have a set puncture depth, and, this is key, the blade retracts automatically after you use it. This design is all about protecting you and your patient from any accidental needle sticks. Okay, stop and really look at this number. This is one you have to burn into your memory. 2.0 millimeters. That's the absolute maximum safe depth for a heel puncture on a baby. If you go any deeper, you risk hitting bone, which can cause a very serious infection called osteomyelitis. So 2.0 millimeters, lock it in. And this table here really breaks down how you pick the right device for the right person. For a routine adult finger stick, a simple puncture lancet is usually fine. But for a newborn's heel, or maybe an adult with calloused hands, an incision-type device that makes a tiny slice can give you much better blood flow, which means you won't have to squeeze the site. All right, let's talk about the tubes themselves. Unlike the bigger venipuncture tubes, these little guys have no vacuum. They work using something called capillary action, which basically means the blood just gets drawn right into the tube on its own. That's why your technique and getting the blood level right between those fill lines is so important for the test results. And just like the big tubes, each color means something different. Lavender has EDTA, green has heparin, you know the drill. But here's the crucial part. You have to gently invert them the correct number of times, usually 8 to 10 for lavender, and you have to do it right away. We're talking immediately, to stop tiny little clots from forming. Okay, so we've got our why and our what. Now it's time for the how. Let's put it all together and walk through the exact steps for getting a flawless sample. This is where your skill really comes into play. I like to think about the whole thing in 4 main stages. If you can keep these in your head, you'll be set. First, prepare. Check that ID, pick your spot, warm it up. Second, puncture. Clean the site, let it dry, and make the stick. Third, collect. Wipe away that first drop, then fill your tubes in the right order. And finally, finalize. Mix the tubes, label them right there at the bedside, and get rid of your sharps safely. And here it is, our second super important safety number. 42 degrees Celsius. When you warm up a site, you're arterializing the blood, basically increasing the flow. The absolute rule is that the warming pack or cloth cannot be hotter than 42 degrees Celsius, which is 108 Fahrenheit. Any hotter and you risk burning your patient. Okay, this next question, it gets to the heart of so many exam questions and, honestly, a lot of real-world mistakes. When you have to collect more than one microtube, the order you fill them in is everything. Do you remember what it is? And the answer, the thing you have to remember, is this simple little mnemonic, GEOS. Now be careful, because this is different from the order of draw for venipuncture. Getting this wrong can ruin your samples. Let's see what it stands for. So here's what GEOS stands for and why it's in this exact order. G is for gases. They're always first because air affects them the most. E is for EDTA, your lavender tops. You collect these next because as soon as you make the puncture, the body starts clotting, and you need to get that sample before any microclots can form. O is for other additives, like your greens and grays. And S is for serum tubes, your red or gold tops, which you collect last because you actually want them to clot. GEOS, commit it to memory. All right, once you've got the standard procedure down, there are a couple of special collections you'll need to know about. These have their own unique gear, and the rules are even stricter. First up, we have the microhematocrit. It's a quick little test that tells us the volume of red blood cells in a patient's blood. It's simple, but its accuracy completely depends on you using these skinny little capillary tubes the right way.
Okay, listen up, because this is a classic exam question. You have to match the tube to the blood source. If you're collecting straight from a finger stick, you need the tube with the red band. It's coated with heparin to stop clotting. But if you're filling the tube from blood that's already in a lavender top, you must use the plain tube with the blue band. Otherwise, you're adding anticoagulant to an already anticoagulated sample, which will mess up the results. And this table walks you through what to do next. You fill the tube about 2/3 of the way, plug one end with a special clay, and, listen, this is a really big deal, you place it in the centrifuge with the clay-sealed end pointing outward. That's the only way the cells will pack down correctly when it spins. Next, let's tackle the capillary blood gas, or CBG. This gives doctors a critical snapshot of how a patient is breathing. Because you're measuring gases dissolved in the blood, any little bit of air can totally throw off the results. Your technique has to be absolutely perfect.
With a CBG, every single second counts. You've got to warm the site first. You fill the special tube by holding it horizontally, not angled down. If you see any air bubbles, you have to get them out before you immediately seal both ends. Then you use a magnet to mix the sample and get it to the lab fast. Okay, let's wrap this up by talking about the stuff that applies to every single draw you'll ever do. The non-negotiable rules of safety, quality, and how to avoid the most common errors. This is what separates a good phlebotomist from a great one. These right here, these are the big ones. They show up on exams all the time because they are so important in the real world. Squeezing the site contaminates the sample. Getting GSOs wrong causes clots. Going deeper than 2.0 millimeters on a heel is dangerous. And of course, the biggest mistake of all is failing to identify your patient or your specimen correctly. And if you look at this chart, you'll see something really telling. The top reasons the capillary samples get rejected by the lab: hemolysis from squeezing, clots from not mixing, contamination from not wiping the first drop. See a pattern here? Almost all of these come back to your technique. They are preventable. You know, when you're working as a phlebotomist, you're not just making up the rules as you go. Your practice is guided by this big three. CLSI gives you the step-by-step procedures, the CDC gives you the infection control rules, and OSHA makes sure you're staying safe on the job. Okay, before we go, let's drill these two numbers into our heads one last time. Are you ready? For a heel puncture, no deeper than 2.0 millimeters. For warming a site, no hotter than 42 degrees Celsius. Those are your absolute safety limits. And that really brings us to the most important question of all. You have the knowledge now. The real test is how you'll use it every day, with every patient, to make sure every single sample you touch is safe, accurate, and reliable. That right there is what makes you a true healthcare professional.